that?
Because I'm in the way.
Oh, there's no reason. I'm the one. Oh, there's you. Yeah.
Wave to your audience.
Hey, good morning, everyone. Happy Thursday. Third day of Dallas Startup Week. I'm Fiona Schlachter. I'm actually with Health Wildcatters, but I'm doing an intro on behalf of the Dallas Startup Week team. We want to welcome you to this session of our Thursday Pulse with Dr. HOMERO RIVAS. We're excited, and with Jack Cooper from Take Command Health. He's going to give us an overview of his startup. First of all, we want to thank our sponsors for Dallas Startup Week: Chase, downtown Dallas, Bellwood, Touch Titans, Dead Mountain, Circles, and Kratos. And a special thanks to 1700 Pacific for this awesome room. We're excited about it. So we'll look forward, and we'll just get started right now with Dr. Zajac.
Thank you. Good morning. All right, we like the new digs. It's our first time, probably the only time we'll be here this year. So welcome to the Pulse, and we rolled this into Dallas Startup Week this April. I thought that would be a good combination of the two. A couple of things we want to run through here. For any of those who don't know me, my name is HOMERO RIVAS. I run Health Wildcatters. The Pulse Breakfast Series is a monthly series around healthcare innovation that we have every month. And it's early. All that coffee. Did somebody sneak some decaf in there? That's evil. All right. In any case, if you don't know, find it on our website, sign up for it. Those of you who signed up for Eventbrite, yes, know that we like Eventbrite, and I hate to say it, but we like functioning sign-up mechanisms. That's why the Eventbrite stayed up, and I think over 100 people signed up for Eventbrite. The other alternative wasn't so great. And we'll stay with Eventbrite and others. That way you'll have it intact. So this is what we always promise you. We promise to get you out by 9 o'clock. Today it'll be actually 8:55 because there's a session in this room at 9. So it's Oren Salmon that has a session here. He's a friend. But I think if I drag it out to 8:57, 58, that friendship will be under duress. So let's try it. We're shooting for 8:55, but Dr. Rivas promised to not damage my friendships in my town. So we will show you a startup, a local startup that will present a 5-minute pitch, and then we'll be on to our main presenter today. We want to thank our sponsor, Page that underwrites the Pulse Breakfast Series, and Josh Stever is here, and Jim Kilbrew, and Pete Winters. Anybody else on the page? Dale. And I don't know your name, so I'm just...
It's
Beth Carol. All right. So thank you guys for helping underwrite this series. And if you have any space needs in the healthcare architectural world and engineering world, seeing those folks, and they can help you out. They do some of the coolest projects around town and around the country and beyond actually. So you've met Fiona Schlachter. You've not met Christy Torres over there. So our team here, there are Twitter handles. My phone was taken away from me, so we can be live streaming on Periscope and
we're live streaming on YouTube as well.
Facebook and YouTube.
Not Facebook.
In any case, if you've been texting me the last hour, there's no chance I will return your text or give you any help in finding us here, possibly Periscope. Many thanks to our Pulse volunteers, Ryan over here, Ross, our intern, and many of the PSW volunteers as well. Helping us out. It's been great to have this. We have this series usually at our place, and the next one will again be at our place. But if you want to join as a Pulse member, you actually buy a subscription for the whole year. And you see the persons with the orange bar underneath the tag are the people that have signed up for the whole year. This is a membership that gives you a few extra perks. So if you run out of seats, you will never not have a seat. But also give you a preferred seat in the pitch day and other events. So helps us kind of predict who will come and plan out the year. These are some of the organizations we support around town. This is not a complete list, but the Health Technology Forum, Health Tool of Dallas, Society of Physician Entrepreneurs, Dallas chapter, North Texas, all have events. We have a monthly newsletter and share all the events that we're informed about to let you know. And amongst the 4 objectives here this morning is for you to meet each other, number 1. Number 2, for you to get an update from us what's happening around healthcare innovation events in Dallas in the next month. Number 3, to see a cool startup present. Number 4, to meet an amazing person that will give you some insights on health innovation. Those are our 4 objectives. So number 2 is the calendar. These are also on our website, but of course, there's an event, I guess today, at the Cancer Brain Institute. There is our wearables panel that's tomorrow here as part of Dallas Startup Week, and then a wearables workshop on Saturday. You can bring your kids. There'll be a Misfit and Samsung. And
Dr. Davis is on the wearables.
and Dr. Davis is on the wearables panel. Then there's an event, I think that's in Austin, beginning of May. That's a venture and healthcare investment event. We've got one in Houston on the 17th, which is kind of cool. A bunch of Chinese investors and startups coming to Texas all around. A lot of them are on life sciences. BioNova Texas has a breakfast on the 19th, and then if you don't know, the Dallas Entrepreneur Center is a great resource around town to help you connect and meet others, and they've got a ton of events as well. Not necessarily healthcare related, but startup related. So now, without further ado, we have 5 minutes, and he knows what happens when he goes over, because he's seen it. He's seen it. He's seen it. Jack Hoover.
Well, thank you all for having me today, and Health Wildcatters, Dallas Startup Week, and the Pulse. My name is Jack Cooper. I'm the founder of Take Command Health. Take Command Health is a website and app that empowers individuals to be smart health insurance consumers. The first decision people face is, well, which health plan do I choose? For me and my wife, a little about 3.5 years ago, I was starting grad school. We had just quit our jobs, moved across the country, had a nice 1-bedroom efficiency apartment in downtown Philadelphia, and were blessed, but very, very, very surprised with a twin pregnancy. As you can imagine, on student loans, trying to decide which health plan I choose is pretty cumbersome. Turns out a lot of folks, when they're looking at health plans, have questions. To my doctor, to be on this plan, is the prescription I take on the plan? Maybe if you're managing a chronic condition or a serious illness, you want to understand how the plan is going to work with the care you need. The reality is healthcare.gov and a lot of existing websites out there, they do a great job of letting you put in a zip code and look at different plans. But when you're just sorting by premium and deductible, you're not really answering the questions that you need. In fact, research shows that 88% of people actually choose the wrong plan based on their known conditions, and it costs them over $500 a year in excess medical expenses. ACA is driving the need for individual support as well. More people will be choosing an individual health plan. So individuals are people not with a company or pursuing their own policy. It's going to triple in the next few years from pre-ACA rates. Take Command Health is a simple, step-by-step, TurboTax-like review that helps walk the consumer through the process. First thing we do is try to help the consumer understand the full breadth of the options available to them. Where most sites will just have on-exchange or healthcare.gov plans, some will have off-exchange. Our database actually has all of those, as well as some faith-based plans that are ACA compliant. As far as I know, we're the only website in the country right now that offers a full view of the options available. The next thing we do is help the consumer dive deeper into the plans to understand what's there. 2 years ago, I believe we were the first to release a universal doctor search, where if you're Dr. Smith, You can enter them into our site, kind of a Google search bar, and we'll tell you which plans he or she will participate on next year. We do the same thing with prescriptions, and we have a really cool database where, for example, if you tell me you're a type 2 diabetic, that's well managed, or if you're a grad student expecting twins, we pull from millions of actual healthcare transactions and process those through the plans and give you an estimate, help you with some analysis of data to see how each plan would perform for you. Finally, we make enrollment super easy, and along the way, we're giving you great advice and plan language, not leaving you with a list of plans to choose from. Take Me in Health is 2 years old. It's been a part-time endeavor for me and my partner. I'm proud to say I left my full-time management consulting job about 6 weeks ago, kind of close to the year. I could be a full-time entrepreneur. Throughout this phase, we've really been bootstrapping and trying to kind of prove a revenue and acquisition model that works with individuals. Pleased to say that in 2 years, we've dramatically reduced our cost of acquisition to such that it's much lower than even a traditional broker going after large groups now. We're also retaining members at a much higher rate as well. I think this is because we're providing much better plan advice, so the plan actually fits and works for the individual. Our greatest referral source was friends, which is awesome to see. And if you're familiar with the Net Promoter Score, we've worked really hard to position ourselves as kind of the unbiased, data-driven ally to a consumer looking for a health plan, and have been able to separate from how people view their health insurance company. What makes Take Me in Health different is really building our business model from the ground up to win with individuals. Most of the websites you see or services offered were traditionally built for groups, so they're kind of individuals are an add-on or an extra burden or opportunity, and we're really focused on winning from the ground up. So I showed earlier it's going to be the fastest growing market for health insurance. We stick to three main things. The first being scalable. One thing we don't have is a call center. We intentionally took our website or our phone number off our website because we wanted users to get used to doing it on their own, have a do-it-yourself TurboTax-like model. The next thing, though, is we want to be sticky and provide great customer service even if we're not picking up the phone. We're really trying, instead of competing on price, we're really selling good advice. Sounds pretty good. And relying on retention moving forward. Finally, heavily innovation focused. We want to be leveraging technology and data and tools over manpower to serve our clients. We have some really exciting growth opportunities. One is just geographic. We're only in Texas the last 2 years. We have some great ideas for offering premium services and data for our members. And what I'm really excited about engaging this room with is what I call our channel partnerships. We've already started white labeling versions of our sites for school districts, talking with health systems and pharmacies in the area, trying to leverage our technology and really go where an advisor or broker, a traditional broker can't. Where can we take this advice engine and deploy it in strategic locations to help people? I mentioned it's me and my partner Matt, and I'm pleased to say we're just days away from closing our initial seed funding round, so we're pretty excited about that. Thank you. Looking to make some key hires, so if you are a developer, I think there are like unicorns around here, but if you're out there, we have money and a job for you. We're also looking for people with experience in social media, user interface design, product design, and development. I should mention as well, we are excited about our board of advisors and the depth and experience that we're still looking around at that group too. So I know a lot of folks here are well connected to the health industry. I'm excited to get more plugged in. I'd love to talk to you too if you think you'd be interested in talking to me. I think during my time, I just want to round up. We've been really pleased with the feedback we've got. The Dallas community has been incredibly supportive. We were Health 2.0 finalists in a plan choice competition and received some great publications here in Dallas as well as nationally. So thank you very much. I think I need to turn it back over, but I'd love to connect with you if there's interest or connections or ideas to be shared.
new members of the Pulse, and let's see, Jim Fowler here? Thomas John.
Woo!
It's right, Thomas John, right? Okay. And Peter Leschmonde. So those are our three newest Pulse members. I failed to mention that earlier. Anybody I missed? Because there might be another couple of people that stuck in. Jack, you joined as well since the last Pulse. So Jack and anybody else? Okay. So anyway, thank you for your support. It means a great deal to us because it allows us to underwrite as well these breakfasts. Now it is my distinct pleasure to introduce my personal friend and used to be Dallas site. He left us for the next post. Dr. HOMERO RIVAS. Dr. Rivas was on faculty here at UT Southwestern when I was as well, and then got an MBA at SMU, and that's how we met. He is a surgeon by trade in bariatric surgery, assistant professor at Stanford. He is also director of, I wrote this down to get it exactly right, surgical innovation at Stanford. Oh, yeah, that would help. Director of innovative surgery, so I still got that wrong. But also, I'll tell you, is just an amazing person. I thought I'd just been gone for a couple of years, but it turns out he left 6 years ago. He's a mentor in Health Wildcatters. He's passionate about mHealth and many things that have to do with innovation, not just surgery. And it is just a delight for me to have him back here in town. And let's give him a great welcome.
It's a great honor, pleasure to be here. It's been a few years, and I really miss Dallas. I think there's great opportunities of innovation, especially here in Dallas. I have nothing to disclose. I want to make it real fast. I could spend all day talking about this, and I'm very passionate about it. I think decisions, we are very old-fashioned. We don't really innovate innovators for that matter. And just the key things to talk about, yes, the key things to talk about is why the business model of medicine is extremely inefficient, very poor, very old-fashioned. What are the characteristics and features of a successful innovation, the profile of a successful innovator, and how is it we can leverage on digital health and ICTs to make it happen. Innovation is something that every new title is going to have. People overuse this word. Certainly here in the U.S., we feel that we have the best healthcare in the whole world. We actually have probably the most inefficient one there is in the Western, the Occidental type of countries. We do have a crisis when it comes to healthcare expenses. Nearly 20% of our GDP goes to healthcare. In the case of surgery, for that matter, it's pretty bad. In general medicine, there's been lots of innovations throughout the last 20, 30 years. That capsule that we take, it takes thousands of pictures when you swallow that capsule. Robotic surgery, where you can have an operating procedure at a distance. Now we do surgery through the mouth, through other orifices, so we don't really have to do a scar. We can do very complex operations by putting needles, like getting access to a vessel and doing like an aneurysm, for that matter, repair. But we still have a very inefficient, a very poor business model that hasn't changed in thousands of years. What that is that we rely on physicians to actually take care of it, one-on-one basis. So it's very artisanal. So I could be in the operating room, I trained for 15 years more or less, and I could be in the operating room all day working hard, and maybe do 5 cases, maybe 10 cases if I push it really hard. But the social impact that my practice of 15 years would have, it's only 5 families, 5 people, that's about it. So it's very inefficient. By teaching other people, I believe that I can just expand myself, but it's very romantic to think that way. So by leveraging on ICTs or information and communication technologies, that's the only way we can actually scale healthcare. There's places in the world, like in India, where you can have open heart surgery for less than $1,000. That's never ever going to happen here, never. So the only way how we can actually surpass this big challenge is by, as I said, leveraging on information and communication technologies. And no innovation will, be universally adoptable unless it makes good economic sense. Everyone has a cell phone. Every morning when you leave home, there are 3 things that you always check. You gotta have your keys, you gotta have your wallet, and you gotta have your cell phone. If you don't have your keys or your wallet, probably you're gonna be fine. But if you don't have your cell phone, you're gonna be completely bad. So things that make something, successful and innovation, it has to be something very simple, something that you don't have to think about it, something that makes sense, something that is certainly cost effective, and that everyone's going to have. Those are the things like the cell phone that they've become an innovation. Promising technologies that we have in digital health, certainly it's called mHealth, telemedicine, certainly the use of virtual reality, augmented reality, 3D printing, and even what we call video drones and artificial intelligence for that matter. But we have to go back to the basics, especially for entrepreneurs. How is that you're going to make your company successful? And you need to think about your end customer. In this case, it will be the patient. There's not going to be someone who's more concerned about their health, but the patients themselves. Physicians, we really care about them, but they care more about themselves than anything else. And nowadays, you can have off the shelf, you can go buy it online, you can buy it in place. Lots of devices that implement ICTs for that matter, that bring healthcare to home or to wherever the patient may be. And I'm just going to run through many of those things. It's just to get your blood pressure. There are devices like a light cord that you can actually just with your phone. You can get real FDA-approved EKG tracing of your heart. You can tweet it, you can share it, you can put alarms, you can do anything, very inexpensive. You can have a patch, or you can have pretty much a mini ICU, like with you all the time. It makes sense, economic sense for entrepreneurs because it's something you have to teach every day, and it's still very low cost. There are devices that are so simple yet they give very sophisticated information. This will give you information to your cardiologist, even what we call cardiac output or stroke volume, and how much volume your heart is actually pumping every second. There are other ones that are not FDA approved yet, like this scan, but it can give you a number of things. It gives you a number of reads. This is mine, and it gives me my blood pressure, oxygen level, a number of things, and it takes it to the cloud, so I can actually track this information myself. But all these things make sense more than anything for example, development of massive clinical trials where patients don't have to go back to see their physicians, and they can actually upload the information themselves without even knowing everything. The medication adherence market. You can diagnose someone with diabetes, you can reduce diabetes rate, you can do all those things, but a lot will depend on patients taking a medication. Well, the medication adherence market represents 300 to 350 billion US dollars. So if you as an entrepreneur can come up with a way how patients will remember how to take their drugs, you're going to make lots of money for that. This is an implantable device FDA approved that you can place in pills. When you take it, you swallow as a patient, you have a device, a transfer suit that you're wearing with you, and it identifies that you have actually taken this medication, and then it tweets it, it sends it to your physician or whatever. You will also let people know that you're not taking the medication. There's going to be sensors like patches for pretty much any disease, especially chronic disease. This is something that has algorithms for asthma patients that when you increase the heart rate, the respiratory rate, it will trigger an algorithm that it will say, likely you're going to get an asthma attack. You better take your inhaler. There's also things just for simple things like just to check your temperature, and pretty much for any body function that you can imagine. So this has developed a movement that is not just local. For example, Silicon Valley, this is a global movement for what is called a quantified self or quantified self. people who actually track and they share all information of their vital functions and every single thing they do throughout the day. To be for elite athletes, even though I'm just an avid runner, I have a vest that you can track all my respiratory volumes and my heart rate and a number of things and pay it all cost. If you like fashion, you can have it in your belt. You can have jewelry that certainly measures your activity. You can have a number of other things. This is for people not to eat too fast because you're moving your jaw. It identifies you're eating too fast, likely too much, and it will give you some advice for not doing it that way. Obesity market, I mean, that's why we don't have enough data. There's like 70% of Americans are overweight, 20 million people are morbidly obese. We have only less than 2,000 bariatric surgeries. I could be old lady operating room and never finish my whole life. Patients, so we need to find ways that we can leverage ICTs to actually do this. Now, everyone has a cell phone, everyone has a smartphone, everyone has a camera, everyone takes screen pictures. We certainly should leverage on things like that. This is a simple, very simple device for autistic children, where they really cannot engage eye-to-eye contact, where you can just create a tracing on the phone. They actually helps them come up with eye-to-eye engagement. There's another one, there's a company called Ginger.io. It actually spies in your phone, so patients who actually have the psychotic, they have a higher index of becoming suicidal from time to time. So what the software does, just simple software, when they become suicidal, these patients, they start making lots of wrong calls. They just call wrong numbers. And so the software identifies that they're doing that, and it triggers a mechanism saying this guy's going to be suicidal. There's actually a p-value raised, meaning a statistical value, that it makes clinical sense to use software like this. Certainly, you could come up with any sort of evaluation, from seeing very sophisticated eye evaluation, doing ear evaluation in the ear by just adapting something to your cell phone. There's already a number of different companies with you have to have a very innovative business model. And the way that, for example, this is a company called Cellscope, this out of the Bay, where they avoid all the FDA regulations and barriers that you may have, is because they cater to the end customer, which is the patient. The patients can choose to take photographs of the inner side of the inner ear, and they can choose to share them with their physician. That is not a medical device per se. It's just a way how they can take a picture and then share it with someone. You can actually identify, because you have high-resolution images, with someone who knows something about medicine, and they can actually say, well, this is an ear infection, take this medication, without the need of you actually going to the office or doing things like that. I'm a digestive surgeon. I'm very passionate about technologies in the operating room. Usually, an endoscopic system costs about $100,000, and it's like a big thing. It has lots of devices. But we don't actually need it anymore. You could actually do endoscopic, laparoscopic surgery with a simple device, which is a cell phone. In this case, an iPhone. You just put a high resolution lens, you connect it with your endoscopic device, and then you can actually perform a very sophisticated surgery with very limited cost. Now, this, I could speak all day about it, so I'm keeping it very short, but there's a huge opportunity for 3D printing. 3D printing has gone in all industries, anywhere from creating dresses, printing food, furniture, or a number of other things. When it comes to healthcare, we actually have been using 3D printing for quite a while. Think about all the dentists, they use all this Invisalign, that's a good way. About probably 25% of adults older than 40, they would have some type of implants in their teeth by that age. And certainly a great percentage of other ones are going to have the need for even more sophisticated implants. But there's a great opportunity avoiding regulation, for example, from FDA, from all regulators, with the use of 3D surgical planning, etc. Prosthetics is going to be a big thing. Certainly with implants, you can do highly customized, because usually when you go to the operating room, you replace a hip. You have sizes like, small, large, extra large, things like that. Well, you can actually get the exact size of your patient by implementing algorithms that will go into your 3D printer. And I predict within a few years from now, every single operating room will have a 3D printer in the operating room, so you can actually print many of the things you will need. Certainly, you can, customize to patients for their, fashion, their needs. You can do things that are low cost. This is from Palestine region, from the Gaza area, where people actually, for pennies, they're doing printing stethoscopes or needle drivers or even oximeters for very simple things. There will be a time you get into the emergency room, you get your X-ray, you get your scan, it scans into the 3D printer, and it prints a low weight, low temperature, low pressure sort of splint that is going to be 3D printed. This is out of Toronto, where people can actually bioprint skin grafts. So you actually have no need to actually do skin graft from other areas, and you can just get it from your 3D printer. This is fascinating. This is the first drug. This is called Aprecia. This is for seizures that has been 3D printed. You would think, why would I care about 3D printing any drugs? Well, the logistics are going to change dramatically. Just like there's the U.S. Postal Service has this campaign that says, if it fits, it ships. They are planning to do something that is called, if it prints, it ships. So at some point, there's not going to be any sort of centers for things, so you just print it at a place. But this drug, it has a more rapid bioavailability, and patients actually will have likely more chance of truly taking the medication more than not. Now, what is really fascinating is actually creating also some social value propositions. There's a lot of people who don't have an upper extremity or lower extremity from an amputation, or they were born without a limb. An entrepreneur, more like a social entrepreneur, decided, what can I do with this? He created a truly functional arm, upper extremity, and then a movement has been created throughout the world where they have a website. You can actually upload your information, this weight, this height, I need my right upper extremity, which I don't have it, it's going to be this length. And you can actually download the blueprints for this extremity, and for pennies, less than $100 for paying what you need to print it, you can actually get it printed. Otherwise, it would be like $100,000 or more. There's going to be some bioprinting available, hopefully, so that will reduce the need for transplants and for other things. We have certainly very sophisticated now imaging techniques where we can do things, and we can actually create and extract out of the software, for example, the hip or any sort of implant you can think about, and then you can actually send to either a virtual reality, you can email it to a patient, for example, so they can see it in a virtual reality environment, or you can actually 3D print it so people can have a better surgical planning. For example, this woman had a retroorbital, like behind the eye, she had a tumor. That the surgeon, the craniofacial surgeon said, well, you're going to likely have to use the eye. The husband of this patient said, wait, why don't we just 3D print the CT scan of my wife and see how we can do this better? They did that. They were able to do some better surgical planning, how to approach that mass, and where the finger of that patient, where that finger is, that's where the mass was. This is after her surgery, so there's a lot of value. Now, you would think, well, that's a rare thing, but there are things like, for example, going into surgery, having general anesthesia every day. We have to intubate your trachea. That can be sometimes difficult, and sometimes there's some emergency intubations and people cannot be safely intubated. You can actually do some 3D printing of the airway, and you can actually plan how to put, certainly the intubation of that patient, and that has great value. There are a number of other things, wearables in the operating room. We were just chatting about a few things out in a sterile environment. I really cannot touch anything. I cannot go to the computer. I cannot do things. And you could just have, this is a myoelectric wearable that you have in your forearm. And by moving your extremity, it causes some changes that a transducer can read. And then you can actually, this will take some time. You can actually, with gestures, open up your computer and like change the slides that you want to see and see X-rays and move them around. And just by doing that, so you really have to scrub out of your case to actually do it. Now, virtual reality, we have several different senses. We have the sense of sight, hearing, smell, and touch. We as physicians, as surgeons, we really can't rely on all of those. Certainly, this is something that has been present for hundreds of years. It's nothing new. And the use of stereoscopy, that means you have the same picture, you put it twice, but in different reception. That's going to give you the 3D sensation that you have. It is something as simple as this device that most of us have growing up. And the same thing you could actually do with healthcare environments, with many of the already things that we have, and you can implement it in your gamer device, such as Oculus, for example, where you can actually get, remember about those imaging, that imaging video I showed you about some like a hip and things like that. I said you can extract out of that. You can bring it into something like this. You can put it in 2 different depths. And then you give the patient or the surgeon or the medical student, whoever that may be, an environment for virtual reality. That company, by the way, Oculus Rift, was a phenomenal success for entrepreneurs in the Bay. They put a campaign, I think it was on Kickstarter. They asked for $200,000. They got $2 million. Facebook looked at that. They told them, those guys just have a fantastic value proposition. They paid the company, they bought the company for $2 billion. For $2 billion. So what they did is, it was phenomenal. Well, Google, a French surgeon from Google said, that's great. How stupid. I mean, those guys on Facebook, they wasted $2 billion. This is something we can do just by doing a piece of carpet. And that's what he developed, a piece of carpet that you can actually buy on Amazon for $5. And it gives you the same sort of perception that you can have with virtual reality, which is fascinating. I actually have implemented that. You can do it in the operating room with some of my trainees, or you can do it with patients, many things. But the key here is to have a good connection with technologists, from software developers, entrepreneurs, and with physicians, so you can bring simple value propositions that you may have in technology to actually help. People have been using over the years, this is actually from Mexico, where people are doing some complex dressing change in the operating room, and to distract the patient, they actually are using virtual reality, so the patient's actually playing a game, doing something, and they're requiring less anesthesia, less pain medication, etc. There are a number of other devices, certainly more sophisticated, implementing engines of artificial intelligence like Glass. Glass was just a prototype. Certainly, there was a lot of hype about it, but still it has created a new movement where there's lots of new head-mounted displays that do more sophisticated things. You can certainly implement EMR, electronic medical records, into your glass, into your head-mounted display, so you can actually do things at a distance. Patients in the field, the paramedic are seeing them, they send the evaluation to the emergency room where they can actually evaluate the patient, and then it can be sent to a third provider if needed. Think about a class like this, or being with a patient. Sometimes I can only bring 2 or 3 people in the clinic room to see a patient with me. Well, I could share that with 100, I could share that with 1,000, with as many people. All the things that we're doing in the hospital, most of them they require a TV screen by now. You can certainly leverage on a device like this to create that and bring that to the masses. We certainly use it for safety checklists in the operating room, where we actually, usually there's a lot of wrong site surveys, there's a lot of mistakes in survey, and this gives us a checklist that until after we have gone through the whole checklist, we get a green light and we can say we have it. We certainly can implement what is called augmented reality, creating a software in front of you so it can tell you how to do the operation, with giving you, it's like a cheat sheet that the patient doesn't even have. You're reading a cheat sheet because it's telling you in front of you how to do things. Wearables are in every single aspect of our life. They're going to be invading us in many ways. They're going to be also implantables. This will not run this video, but it's a very interesting video that you can actually, more than just seeing augmented reality in front of you, can actually interact. There's a small startup out of the Bay called Apps4Patients Labs, and you can actually, I have those glasses. With one finger, I can bring an X-ray, I can make it bigger, I can say, well, I don't know for that. Get the vital signs of a number of things, but this is how classrooms are going to be. We need a blockbuster like this that we have in photography and social media. We need to implement that in medicine, so we can actually bring that to business. Drones, they make lots of sense in the future. Dallas can have a lot of traffic, lots of major cities in the US. You get you have your personal wearable, you're getting a heart attack. It senses that your heart rate is going down or is going up or whatever. It sends a trigger to your personal drone. The drone will fly to where you are, bypasses all the traffic, all the needs, drops you, gives you an aspirin, or it gives you a way how you can get a defibrillator, and it will save your life. Certainly, we will have various adoptions. The biggest one, and I'm telling you as a member of those, is going to be the changing the mindset of physicians. That is the biggest thing. That's why I advise entrepreneurs to actually target end customers, in this case patients, more than regulators, more than administrators, more than physicians, but who are actually target patients. Certainly, doing everything open source, that's the difference of a successful innovator and a successful physician. A physician is very risk averse, we never like to go with risk, we keep it very safe, so we never innovate. And so that's how we can do things. We're going to have next June a meeting where we have a society called Watch, which is wearable technologies in healthcare. We're going to have our 5th meeting at Stanford next year, and I would welcome any of you to come to Stanford. The other thing, you have my contacts on social media. I always like to collaborate as much as I can. I'm a very busy person, but I certainly learn more from people like you and patients, entrepreneurs, other physicians than my own experience. Once again, I'd like to thank you for the opportunity and be more than happy to answer any questions. Thanks.
Five more minutes before we get kicked out. So, any questions for Dr. Rivas? And we'll move out.
I understand like big healthcare systems. I just felt that she was saying the work at Stanford, there's a lot of hoops and credentialing and things that you have to go through. So at what point in your business should you kind of start going through that process of work with your relations?
Yes, so from what I can get from your question is that there could be lots of innovations going on, but there's going to be some barriers or some regulation that you will have to face, and how soon you should address that if you go to one. We go back to the last thing. Usually the mindset of a successful entrepreneur, there's a lot of them being naive, not knowing about things, and that's a blessing in many ways because they just go and do it. And if they get in trouble, it's always better to ask for forgiveness than for information. That's unfortunately the mindset that we have. And we have to change that a little bit. It's difficult in medicine because if you are an entrepreneur and you ask for money, you say, I have had 8 startups and I have failed in all of them. This is the best one. They will take it very seriously. That if you are a surgeon and then you tell your patient, well, half of my patients have died. But this time it's going to be good. So there has to be a fine line in those things where you can actually make it. But there's a lot of the innovation that happens in the world is done outside the US. Let's put it this way. Like body minds, many of them are in the US. So you have to. I'm not saying you have to abuse the opportunities that you have in other places, but you have to have an open mind of where is going to be the best place for this. And I would say that the most critical thing is not to see if it's going to work with the technology is going to be working well, or if the regulation is going to be available, whatever that may be, is to create an innovative business model, how this will be sustainable and it will make money, when we say that. Because that's what's going to predict if we're going to be successful or not.
You had mentioned, and you also showed pictures of you using it through Google Glass. Are you actively using it? And based on your usage, have you given feedback to Google about its weaknesses or
Very good. So we have, at any university, unfortunately, you have to have what is called IRBs, institutional report. And we have one for the use of wearables as a single grade. So yes, I use that and a number of other things. We really don't use, we explore their uses for many different things. I work with many different startups, and certainly I have given my advice to Google for those things. But it's something that it's a work in progress, okay? And it's creating, as I said, something that will give meaningful value. Some people have found some value, for example, people who have problems with dyslexia, more than dyslexia, some like Alzheimer and other things, where you can get a mental prosthesis by having head-mounted displays that usually remind us of it. And while there's a lot of criticism behind the use of glasses, because that being hyper-focused and like that, there's some good value propositions that have made some sense and that will prevail once we make some decisions. So yes, we work on those things. Not every patient is sensitive, but with a range of things.
All right, we'll have to move out here. Again, thank you for coming. Dr. Rivas, you'll be available outside as well. We'll let the next panel come in. There is a session this afternoon at 2 p.m. called Health Startups 301, which is live up to Series 1. Lee Nesbitt, Tom White, and Paul Marchman will be speaking. Paul just sold his company for $80 million. All three are mentors and Health Wildcatters. But you need to hear these stories. Yes, that's a way off. Those were generated yesterday, these firms, but they all are serial entrepreneurs here, very successful. They're here in Dallas, making things happen. This community is growing, and we're proud of them. There are schedules here for the rest of the healthcare track. If you don't have one yet, there's still 1, 2, 3, 4, 5 events, 6 events, including that one this week. So it's not too late to catch the rest of Health Innovation and Healthcare Startup Week. And with that, again, thanks to Dr. Rivas and his speaking on
So do we need to close out all of this business?
Yes.
Oops, sorry. I almost ran you over. I don't know, I think it automatically does. You know, just now.
Yeah, I just ran out.
Yeah.
I think that's it. Cool. That was really good.
Alright, so after this, I will be